If you have a deviated septum, symptoms can include everything from difficulty breathing through your nose to frequent sinus infections, snoring, and sleep apnea. Fixing it used to require a trip to the operating room. But Dr. Raza Pasha with the Pasha Snoring and Sinus Center has a new in-office procedure. There's no surgery and no downtime. Dr. Pasha and his patient, Mark Cochrum, shared how it works. Dr. Pasha, a lot of people have trouble breathing, as silly as that could sound, but instead of doing something about it, they just kind of compensate for it.
Yeah, and one thing that we definitely focus on are people that have problems breathing day and night. I mean, we deal a lot with snoring and sleep apnea, but it's important that you breathe through your nose for many reasons. Not only does it feels good. I mean, your nose has many function. It filters air, it warms the air, it moisturizes the air. And especially as you push yourself as an athlete, you'll find a lot of people, especially professional athletes, are focused on their noses because when that air, that filtered, warm, moisturized air gets in your lungs, it's much easier for air exchange. So your efficiency goes way up. So if you and you know this because when you run, you breathe through your nose. You're taught to breathe through your nose and out through the mouth, and that's so that oxygenation, that air, is much higher quality than as if you're breathing through your mouth.
Yeah, and when people kind of compensate, they'll start breathing through their mouth instead of their nose. All right, so Mark, you had a hard time breathing. Did you realize it at the time, or was it a series of other things like sinus infections that kind of led to that conclusion?
Well, I did know that I had some issue breathing, but the main thing that had me do something about it was sinus infections. I started getting sinus infections more and more, went from once a year to twice a year to 3 times a year to 4 times a year. And then it's like, okay, I got to do something about this.
And it started draining into your lungs even. And so you have this kind of cough.
Exactly. It would drain into my lungs. And then I would end up with sometimes what I would get a full-fledged flu-type symptoms and that sort of thing. Have to go get steroid shots and stuff like that to do something about it. And this has been just tremendously better.
All right, Dr. Pasha, he mentioned steroid shots. A lot of times we do medications or things to address the symptoms, but it's not really getting rid of the actual problem. So how'd you actually get rid of the problem for him?
So let's walk this through. I mean, his complaint is that he was coughing. You heard that. He's having recurrent sinus issues, and he has a lot of postnasal drip. And not, again, everyone's a little different. And in his case, there's many different contributing factors to his problems, but he had a pure structural problem. A lot of my patients have allergies. A lot of patients have recurrent sinus problems because they have different types of infectious states. But in his issue, he really had a very simple issue. Is the wall that divides the left and the right side of his nose, called the septum, was crooked, and it was preventing him to have an adequate airflow, and it essentially blocked his sinuses. And we just really had to focus on that.
All right, so that was taken care of. What is the actual procedure called, and what's the downtime?
So traditionally, when anybody has a septal deflection or septal deviated nasal septum, what we offer is what's called a septoplasty, and very, very common. We've done 3,700 of them in our clinic, and that requires an operation. You go to the operating room, we make a small incision inside the nose, and we straighten out the septum. And it's fairly easy, it's fairly quick, and it's something, however, that requires anesthesia. What we've been able to accomplish in the operating room, we can now emulate that quite nicely in the office. And way back in the day, and we were one of the first to do balloon sinuplasties and for treating sinus disease, we used that exact same technology, and we're now able to straighten out the septum by using the balloons and we place on both sides of the inside of the nose to straighten out the septum, which is pretty novel. And we use different techniques. Sometimes we have to address these different spurs, but generally speaking, we've got a brand new procedure that we can do in the office that does not require anesthesia, and we can correct that septum. The long-term results looks fantastic. There's no post-operative care. You don't have to have splints in your nose. There's no cotton. There's no packing. There's no time off work. And this has worked very, very nicely, particularly with Mark.
All right. And Mark, how long did it take for you to realize, wait a minute, I don't have to compensate through my mouth anymore. I can really breathe through my nose?
It started to happen right away. But now, after a few months passed, I just noticed it more and more that I am being able to breathe through my nose instead of my mouth. And just like Dr. Pasha said to begin with, it feels so much better. And I do run a few times a week. And, you know, as he said too, you know, you're taught to, when you're running, to breathe through your nose. I tried to do that, but I couldn't do that before. And I'd just get out of air and I'd have to breathe through my mouth. And now I can. And one of the strange things is I love to sing in the choir at church and things. I can feel like I can sing better. I can breathe better.
All right, there's somebody out there who's having the same issues that you were having, who keeps putting it off. What advice do you have for them?
Go get checked. Go in, let Dr. Pasha look at them. He was wonderful at going through and showing myself and my wife exactly what was going on, what the problems that I had, and what it was going to take to address it. And he was, you know, very good about explaining everything to us. And we had no doubt when we went in to take care of it that it was going to be done.
All right, Dr. Pasha, and for a lot of people, the more they put it off, the worse things get. They can get compounded, so just get it taken care of.
Yeah, there's no reason, Deborah. We can make anybody breathe through their nose. This is not a big challenge for us. We've been doing this for a long period of time. There's multiple things that we can do. Not everybody's the same. Patients come in and goes, I want what he had or what she had. But the important thing is that we will spend the time to do the detail work, the diagnostic work, so that when we decide on whatever therapeutic options you have, that it makes sense.
All right. Thank you very much. It's a breath of fresh air.
Thanks, Deborah.
To book your appointment with the Pasha Snoring and Sinus Center, call 713-523-8800. That's 713-523-8800, or log on to pashamd.com.